Here we go. Good morning, everyone. Brand new edition of Sports Medicine Weekly on this Saturday morning. I'm Steve Cashel, joined by my usual co-host, Dr. Brian Cole. He is the head team physician for the Chicago Bulls, co-team physician with the Chicago White Sox, sports medicine specialist, orthopedic surgeon from Midwest Orthopedics at Rush. How are you, Dr. Cole?
I'm doing great this morning, Steve. Great to see you.
Good. Well, the NBA training camps are underway already, the exhibition season, and kind of an interesting story as we start our show this morning about Paul George. Wow, you remember that he was a third-place finisher in the MVP voting, and wow, played with the Thunder, of course. Before that, the Indiana Pacers, but he's had some shoulder injuries. And as it turns out, he had shoulder surgery, repair those issues when no one was paying attention, they said, with the Thunder, and now he's on the Clippers, and I guess he's had bilateral shoulder injury and out until November, meaning surgery on both shoulders.
Yeah, I mean, this is notable. Obviously, Paul George is an amazing player. And to take a guy like this and to have both shoulders involved, and he's had two surgeries as reported by the media, one in May and one in June. The May one was on the right and the June was on the left, and both with, tough problems. I mean, a partial rotator cuff tear, that can be managed, pretty straightforward. And again, he's not a thrower, so the likelihood of getting back is very, very high. But it's such a tough, especially after coming off a trade, it's in all the dynamics of the back and forth with the Clippers. I would say this, it's a challenge because getting him ready for the season is tough. But I will say, historically, when I look at our overhead athletes who have shoulder problems versus our basketball player with shoulder problems, we do so much better in basketball than we do, for example, in baseball. If you have a baseball player, a pitcher with a rotator cuff problem, the success of getting back may be 50% in some series. But if you have a basketball player with a rotator cuff problem, success rates are much, much higher. So it's unfortunate for sure, because when you're talking about, here we are in the midst of preseason games and camp. My guess is, if I had to statistically say, we're going to be starting to ask more. We'll be asked more and more, Steve, to sort of guess on these things too, I bet, just giving the dynamic of what's happening in sports. But I will tell you that I'd have a reasonably high level of confidence that he's going to do just well or just fine in getting back to sport.
How are rotator cuff tears? Are they common in basketball?
It's not that common in basketball, and he's a young guy, so he had a partial tear, which means it was probably just that, a partial tear. And the interesting thing is that people can have, the fascinating thing about the shoulder is that there's so many issues that can cause shoulder pain, and partial tears are actually not that uncommon, at least picked up by MRI. So whether or not the partial tear is the only thing responsible for his pain, might be questionable. But that being said, when we treat a shoulder that doesn't respond to non-surgical treatment and there is a partial tear, we want to sort of carpet bomb the whole area, if you will. We don't want to leave any stone unturned, and we fix even partial tears in many instances in this type of athlete. I will tell you, in baseball players with partial tears, we sometimes just what we call debride them. We just trim them up and clean them up because it's such a challenge in the MLB to get a player back to the same level of play compared to non-MLB or non-throwers. So, but a partial tear or any tear that's being treated in the NBA is very rare. We're actually about to embark on a research study with the NBA Research Committee looking at the incidence and reporting on it because we have such good data now in the NBA about all injuries. And specifically, we haven't looked very closely at shoulder injuries because they're just not as common as we see in hamstring strains and patella tendonitis and foot and ankle injuries. It's just not as common.
What about the arthritis? So, do you ever see that we always talk about arthritis in knees, and I remember, Jordan and Pippen, but, how about in a shoulder for that young an athlete?
Yeah, so it's rare. And what's fascinating about shoulder arthritis is the following. If I have any given clinic day and I look at the age of my patients who present with shoulder arthritis, it tends to be significantly older than patients who present with knee or hip arthritis. And that's because people who have shoulder arthritis tolerate it exceedingly well. It's just that I think it has to do with the fact that the shoulder joint is a very mobile joint with lower loads across it compared to the hip or the knee. So give you an example, real life example, you have shoulder arthritis in your right shoulder, right? I told you that when we operated on you. But I don't think it's causing you a problem. And you could have had it for 10 years, and you could go 30, 40 years God willing, and it may never be an issue. Do you follow me? So it's extremely
Does it
well
limit
tolerated.
mobility, though?
In
Is
the
that what
advanced state, when
Okay.
those who come in my office, they sometimes come in and they can move their arm out to the side by 10% of what they can do in the other shoulder. I'm like,
Yeah.
how have you lived with this? They're like, well, I just kind of adapted. And you ask them why they're here, and they said, well, I was doing okay, but I can't put something up in the cupboard, or I can't do my hair, or I have night pain. And once they get night pain, that's what usually drives.
That's what
up.
I had, yeah.
Right. You would think about it. That's what was the decision point for you.
Golf
if
was
at-
fine. It was the night pain that
Right,
killed me.
right. You got to sleep.
Yeah.
So
But tell me again, we've talked about this months ago. When you went in and did my tenodesis, okay, which was the biceps tendon is what you cut right
Yes.
next to my armpit
Right.
and then reattached it to my humerus bone.
Right.
Did you tell me you took out a bone spur, right?
Correct.
Did you shave off a bone spur? And
That's
do you,
correct.
Do
We
you
shave it.
shave off arthritis at all, or what
Not
do you
really.
do? You can't shave arthritis off.
Well, arthritis can be innocuous and not related to any symptoms at all. So doing something for it isn't always required. But if there are loose arthritis is loss of cartilage. And if you have loose flaps of cartilage or lots and lots of inflammation, then what we can do, and I did for you, is with a shaver, it's a very simple way to sort of kind of mow the lawn. You go in
Yep.
and you just trim up the flaps and things like that. And if it's a source of pain, that might or could help. But it's not. Unfortunately, it's a little like peeling paint. You can have little areas, and once you clean up the peeled paint, 5 weeks later you get more peeling paint. Don't worry, yours was not that advanced. Okay, we don't have to trade you in yet. Yours was very, very minor. But arthroscopy, or using a camera and a shaver to clean out arthritis, can be a little less than perfectly gratifying if that's the sole source of symptoms. We do it for young people with lots of arthritis as a transitional procedure to stave off shoulder replacement, but many of those patients within 2-3 years will come back with recurrent symptoms, and we bought them a little time before they might need a shoulder replacement.